Hi, my name is Alexa Smith, and I chose to do my project on methicillin-resistant Staphylococcus aureus, which is MRSA. What is MRSA? MRSA is a Staphylococcus aureus with resistance to a specific class of antibiotics, which is penicillin-resistant penicillin. MRSA stands for methicillin-resistant Staphylococcus aureus. Staphylococcus aureus is the scientific name for the bacteria that causes staph infections, including, most frequently, skin and soft tissue infections such as boils, deeper infections including invasive of the bloodstream and spreading around the body to cause serious life-threatening infections such as septicemia, abscesses, meningitis, and pneumonia. MRSA was first reported in 1961 in England. It took only a few months from introduction of the first penicillin-resistant antibiotic to be recognized as an infection from MRSA. Clinically, MRSA isn't particularly different than staph without methicillin resistance. Methicillin resistance by itself is not an added risk for the individual having a staph infection. Other antibiotics are still available to treat MRSA infections. However, MRSA is a concern to medical and public health communities in general. It represents a marked increase in antibiotic resistance in staphylococci. Different antibiotics need to be used to treat and prevent it. More expensive antibiotics such as vancomycin often have more side effects, and increasing their use may result in additional antibiotic resistance in staphylococci, potentially hindering them in the future very difficult to treat. Reducing the number of staph infections caused by MRSA is important in fighting against antibiotic resistance. How is MRSA transmitted? Staph doesn't always cause infections. A person can have it in their nose or on their skin without having an infection, but is still available to transmit it to others. Like other staphylococci, MRSA is spread from person to person by skin-to-skin contact. Staph on the skin can develop into systematic infections when the skin becomes damaged, including in the hospital when an IV needle is placed through the skin. Also through intermediate objects such as gym equipment or towels. There have been many outbreaks among wrestlers and football players, persons sharing jacuzzis, and persons in crowded jail settings. Factors that make it easy for MRSA to be transmitted, which is what we call the 5 C's, is crowding, frequent skin-to-skin contact, compromised skin such as abrasions and cuts, contaminated surfaces, and lack of cleanliness. What are the different types of MRSA? MRSA developed from methicillin-susceptible staph because methicillin and its relatives such as oxacillin were widely used and selected for resistant strains. The selection process has happened at least several times in the last 10 to 30 years. In the 1960s, strains of MRSA emerged in the hospital, which is hospital-associated MRSA. Hospital strains tend to be resistant to additional antibiotics and often cause bloodstream infections. In the 1990s, new strains of MRSA emerged in the community, known as community-associated MRSA. Community strains tend to produce toxins that lead to skin infections and abscesses, but are less often resistant to other antibiotics. Over time, hospital strains have moved to the community, while community strains have also been brought into the hospital. What is community-associated MRSA? It's a type of staph bacteria that is resistant to certain antibiotics, including methicillin, oxacillin, penicillin, and amoxicillin. Infections acquired by a person who has not been hospitalized or had a medical procedure. Infections present as skin pimples or boils that may be mistakenly identified as a spider bite. It differs from hospital MRSA, which occurs in a hospital setting, and it's not new. It was first identified in 1968. Are certain people at increased risk for community MRSA infections? Of course, outbreaks of community MRSA have emerged among athletic teams, such as basketball, football, and wrestling, daycare centers and schools, dormitories, correctional facilities, military recruits, and tattoo recipients. This slide shows common factors of community MRSA. The top left is contaminated surfaces. The top right is lack of cleanliness, is dirty hands. The bottom right is crowdedness, like in the hospitals. And the bottom left is compromised skin, that's having skin open. Signs and symptoms of MRSA. MRSA appears as bumps that is painful, red, leaking pus, or swollen. This may represent a spider bite, pimple, or boil. Bumps under the skin that are swollen or hard to the touch. Skin around a sore that is warm, hot to the touch. Bump that grows rapidly and does not heal. Painful sore accompanied by fever. Rash or pus-filled blisters. or draining bull or abscess. This next slide is some pictures of what to look for MRSA. And the next slide as well. The top left is the person's finger that's infected, and MRSA in the bottom right is a leg that's infected. MRSA in the healthcare setting, also known as hospital-acquired MRSA. Some historical risk factors for MRSA in the healthcare setting is prolonged antimicrobial use, prolonged hospitalization, exposure to a colonized or infected person with MRSA, being over the age of 65, staying in intensive care or burn unit for a long period of time, and most commonly residents in the nursing home. Common infections include surgical wounds, urinary tract infections, pneumonia, and bloodstream infections. How is MRSA treated? First, a healthcare professional will use a culture test to confirm your diagnosis. Antibiotics, take all dose. Vancomycin and daptomycin is what they use to treat MRSA. Don't share antibiotics or save for future use. Topical antimicrobials. Incision and drainage of the wound if necessary. Cover your wound at all times so that way you won't get reinfected with the infection. And exclude from close contact if drainage can't be contained. What we need to do to prevent transmission. Practice good hygiene is always number one, with keeping hands clean by washing thoroughly with soap and water. Use of alcohol-based hand sanitizers that have no access to soap and water. Shower daily and after athletic practice or competition. Keep cuts and scrapes clean and covered with the bandage until healed. Discard used bandages and tape in garbage, and avoid contact with other people's wounds or bandages. Other recommendations to avoid transmission of MRSA is maintain a clean environment by establishing cleaning procedures for frequently touched surfaces and surfaces that come in direct contact with people's skin. Check skin routinely for signs of infection and monitor wound management. Launder all clothing and washable equipment in hot water with detergent and dry in a hot dryer. And avoid sharing personal items such as towels, razors, clothing, washcloths, lotions, and cosmetics. Preventing MRSA in the healthcare setting is use standard precautions such as hand hygiene and contain body fluids. Transmission-based precautions, just contact precautions, you will use gloves and gowns, and appropriate use of antibiotics. Some additional information on MRSA. The bottom left picture will show you a piegram of community-acquired MRSA, healthcare-acquired MRSA, and hospital-acquired. You can see that community is half of healthcare and hospital, so the community definitely needs additional information on what MRSA is. Proper use of hand hygiene. Hand hygiene is the number one way to prevent MRSA infection to anyone because it's person-to-person contact. So you always need to wash your hands, no matter what. Education. In the healthcare or hospitals, patients and family, you can use multimedia like computer use or iPads and standardized handouts. For staff and medical staff, you can do in-service learning projects, safety fairs, and signs outside doors and on the walls. And in communities and populations, you can use flyers and pamphlets or brochures and health fairs at local health departments. Lastly, things to remember. Always wash your hands. That's the number one way to prevent MRSA. You need to practice disinfection techniques and good hygiene. Maintain clean environments. Make sure you complete all antibiotic doses. And educate.